During the Arab Health Exhibition, the Dubai Health Authority has announced significant information to the press in a series of press conferences. One important update was the launch of the new healthcare regulations for 2016. These are composed of 9 health regulations with new developments in the healthcare field that aim to ensure patient safety and provision of high-quality health delivery in line with international standards.
Dubai Health Authority announced 9 health regulations, which 6 of them are related to the health facilities and 3 of them regulate the profession scope of practice of physicians. The facility regulation talk about oncology regulation, laser hair reduction regulation, regulation of hair implant, colon hydrotherapy, sleep laboratory, and regarding the professional regulation, scope of practice of general physician, family medicine, and obstetric and gynecologist. Those 9 regulations are one of the innovation in of Dubai Health Authority because oncology regulation is the first type of it in the Middle East. Sleep lab regulation are the first one in the UAE. And scope of practice of obstetric and gynecologist also is the first time in the UAE. Those regulations will assist investors to explore their opportunity in the market of Dubai, and those will guide them on the specific requirement of the licensure, and also will guide to provide a safe and healthy services for patients in the Emirates of Dubai.
In addition to this, Dubai Health Authority also released the results of the second National Health Account System. The system's goal is to provide accurate data on healthcare investment across the public and private sector in Dubai.
The National Health Account is a model of basically tracking spending on the health system in the Emirate of Dubai. So it looks at where does the money come from, how is that money being spent, where is it being spent, and who are the beneficiaries that basically have utilized this amount of money. This is an annual report that basically tracks how each one of those parameters change in the Emirate of Dubai and basically in line with the strategic directions of the Emirate of Dubai. Well, we obviously spent a lot on curative care, that is care in hospitals, and we would like to see more spending on preventative care, for example. That's one of the main areas for development for us. Also, we see good increase in spend in the private sector. Again, that is in line with the strategic direction of the government of Dubai, and a fantastic news for potential investors coming into the Emirate of Dubai, where definitely there is space for development within the private health services provision. Dubai is looking to be one of the best health systems in the world. We want this to be a high-quality, transparent environment that attracts both health tourists, but also investors that are high-quality investors that want to come into Dubai, and that is in line with the strategic direction of the government. So there are areas that we want good quality international players to come into the Emirate of Dubai, and these have been outlined in the strategy. And we are obviously moving very well in the implementation of health insurance, and the population is getting covered. And during this year, 2016, we expect the whole population of the Emirate of Dubai to be covered by health insurance. So that goes in line with that government strategic direction.